Hi everyone, welcome to PawTube, a video chat series focused on pet health and well-being. Joining me on today's PawTube is none other than Dr. Karma from the Vet Hospital. Hi Dr.
Hello.
Karma, thank you so much for joining me on PawTube and welcome back.
Thank you very much. Thank you for having me. It's nice to be back.
It's lovely to have you back. And today we're going to be discussing pancreatitis in dogs, causes, symptoms, treatment, and a little bit more. So shall we get started?
Yeah, whenever you want.
All right. So, Dr. Karma, starting with a very basic question, what really is pancreatitis? Can you help us understand?
Yeah, like any word finishing with itis, it means an inflammation. It's an inflammation of the pancreas. So normally, the reasons behind it, they are still a bit fuzzy, even nowadays. But in a general way, dogs who have eaten a lot of high food fats, especially in one sitting, they tend to overload the pancreas, because the pancreas is the organ that segregates the enzymes that will break this down, and then the pancreas gets inflamed. And that's what it means, an inflammation of the pancreas. Then this inflammation has consequences. And this is what of the things that we will talk about.
So, as I understand, there could be several causes for pancreatitis. Could we get
Yes.
into some of the causes? You spoke about high fat food, of course, but could
Mhm.
there be other causes? Also, it'll be interesting to know, are there certain dog breeds that are predisposed to the condition?
Yes, and everything, yes. So having the principle of high food in the bloodstream being able to cause pancreatitis, there are some diseases and drugs that can cause that. So the dietary factors have always been the number one, like high food, or the typical dog that raids the beanbag and eats all the fat of their ingestion of trash sometimes upsets the pancreas. But then medication like steroids, furosemide, zinc. I have a full list if you want. I can give you the one by one, like L-asparaginase, phenobarbital, azathioprine, sulfonamides, organophosphorates, which this is insecticide, steroids, furosemide, meglumine, which is for horses mainly, etc. These drugs can cause pancreatitis, so we have to be careful with patients who have had pancreatitis using these drugs. Then some diseases can predispose a patient to have pancreatitis. For example, hyperadrenocorticism, like Cushing's, because that raises cortisol, and as we said, steroids, corticosteroids, can cause pancreatitis. That's one. Hypothyroidism, so a low active thyroid can cause that, because the cholesterol and fats are high in blood as well. Or diabetes mellitus. Diabetes mellitus can cause pancreatitis. Also the other way around, but this one is more like patients who have pancreatitis can develop diabetes. Why? In the pancreas, you have the Langerhans cells, which are the ones that produce insulin. If you have an inflammation of the pancreas, these cells are not going to produce enough insulin, so the dog can become diabetic. This happens in humans, like this gestational diabetes because of compression. Cats are interesting because they can have pancreatitis, develop diabetes, and if you manage it on time, you can cure them. They can bounce back from diabetes, which is really interesting.
Very
Then you have
fascinating.
some.
But I'll just stop you for a second and ask you, is that true for dogs as well or only cats?
Only cats. For dogs, there's been some studies that they are furthering into diabetes in dogs, but this bounce back from diabetes so far is described in cats. As far as I know, maybe there's something new, but what I know is that cats can bounce back, and it's very exciting because that, like 20 years ago, wasn't a thing, and now it is. About genetics, yes, there's a mutation, the SPINK1, that you can test, I think in IDEX or somewhere in England, that is predisposed to pancreatitis. And then you have dogs that they can have acute pancreatitis, like terriers, poodles, Dachshunds, the Cocker Spaniel, Alaska Malamute, and miniature Schnauzer. I've seen so many Schnauzers that they have this. Also, Schnauzers and Cockers, they can be predisposed to have high levels of fat. So I think everything is a bit linked. Then you have dogs that they are more predisposed to have this chronic pancreatitis and having flare-ups, like the Cavalier King Charles, Collies, and Boxers. These dogs is more difficult to see the signs because they kind of live with this chronic inflammation. But anyway, but you can find out. Then other problems like hypertriglyceridemia, same as us, like genetically you have more fats in blood, can cause pancreatitis, like Babesia, which is a blood parasite. Ehrlichia can cause pancreatitis. Honeybee venom, which I never heard about, is the first time. Immunoglobulin related, so immunomediated problems. Age is a predisposition, obesity is a predisposition, and some surgeries. It happens that when you've had, for example, it happened to me that I had a surgery that I was doing a gallbladder removal. And when you are holding the intestine, the duodenum, you have the pancreas next to you. So by holding the pancreas for a long time, you can have a transitory pancreatitis. This can happen, but this subsides with pain relief and everything. So and then hepatitis cholangitis. So the fact that the liver gets inflamed, the pancreas can get inflamed as well. So yeah, so this is more or less a list of things that can cause pancreatitis or can predispose to pancreatitis.
Wow, that is indeed a lot. And
I'm sorry.
no, not at all. It's very informative. But if I can summarize more simplistically and break it down, number one would be food. Number
Yes.
two would be medicine and constant administration of medicine.
Certain
medicine. So, for example, I am familiar with phenobarbital. So
yeah.
seizure
I
medication.
haven't seen that many. Yeah, I haven't seen that many cases of phenobarbital-induced pancreatitis. But what I have seen is steroid-induced pancreatitis. Steroids such as prednisolone are medication that is needed in many cases, but you have to be careful. You have to be careful when you use it because it can happen. You can start with a chronic patient that is on steroids for whatever reason, and then comes with abdominal pain. You have to think of pancreatitis because it's a possibility. Yeah, for me, steroids are probably the number one careful drug.
Sure. And thank you for saying that. And of course, there are certain breeds that are predisposed to pancreatitis. You did mention a few tests just a few minutes back that could be done. On your list, is there or are there certain tests that can be done as preemptive measures, perhaps for obese dogs, senior dogs, just to be careful?
Okay, there's nothing that can tell you prior from it to happen. What you have is in the general, so because pancreatitis is diagnosed as a compendium of things like the story, the symptoms, etc., ultrasound. But it's true that when you do a blood test, there's two enzymes, amylase and lipase, that they rise in dogs when you have pancreatitis. So I guess if a patient is okay, but these enzymes keep creeping up, you might want to be careful with the fat intake. Then when you have a patient that you suspect that they have pancreatitis, vomiting, diarrhea, pain position of the abdomen, then they created a test called Canine Pancreatic Lipase, CPL. You have it in feline as well. Canine Pancreatic Lipase and feline pancreatic lipase. These two are a bit more specific of pancreatitis. When you have pancreatitis, they are elevated. The problem with pancreatitis is that there are other things that can cause raise of these enzymes. So that's why you have to see a bit as a global thing. So an increase of amylase is not always pancreatitis, but it's quite likely. So you have to be aware of that. But yeah, if you have an old dog and you want to know if there is a possibility of pancreatitis, I would definitely do amylase lipase and canine pancreatic lipase. because if the three of them are elevated, you might want to be careful. Maybe you want to do an ultrasound and see how this pancreas looks. We have had cases of abdominal pain that when you do an ultrasound, you think it's plain pancreatitis and then you see a tumor there. That can happen.
Okay.
In cats, so you know, the amylase and lipase in bloods can be normal with pancreatitis.
And now that we have discussed causes, now that we've discussed tests, can we move on to certain symptoms that pet parents can be aware of, should be aware of, and should look out for on a regular basis? You know, if a pet is kind of showing these symptoms, then that becomes a red flag.
Yeah. For pancreas, you have to basically look at what pancreatitis do in your pet. So when you have an inflammation in the pancreas is near the stomach, is touching the stomach and touching the duodenum. Therefore, what you will have is gastritis. So it's going to inflame the stomach. When your stomach is inflamed, you will vomit, you will be reluctant to eat, you will eat less, or you will eat slower. Sometimes you will refuse your own food, but you will take treats because you like them, but will be, a bit like not as happy. Because it's inflaming the duodenum, the same can happen. The duodenum is the first part of the intestine. So if that gets inflamed, can cause vomiting because it doesn't empty as much. That vomits can be either acidic from the stomach or more fecal, smelly. You can cause diarrhea as well because it's inflaming that part of the intestine. And pain. Some dogs, they are reluctant to move. They don't want to go up the stairs because they have to do this. So then they're moving. Sometimes you will see them walking like that, like arched to relieve pressure from the abdomen. Some dogs, they will be smacking their lips. That can be a sign of anxiety, but can be a sign of nausea.
Okay.
Pancreatitis, the first sign of pancreatitis for me is eating less because it doesn't sit well. Obviously, you have a greedy Labrador, you might not find that, but if vomits or has diarrhea, maybe you want to look into that because Labradors have predisposition for thyroid problems. So you have to look into that. And other things, mainly the abdominal pain. When you touch the abdomen, they would do like this kind of noise. Or exactly. Or the stomach will be hard. Some of them, they will rather lie down in the side so they don't put pressure. We call it anti-algid positions. So positions that release pain from the abdomen. And some of them, they don't want to go for walks because they are in pain. So these are the symptoms of pain and gastrointestinal problems: vomiting, not eating, diarrhea.
All right. And do these show up over a period of time, or can this happen very rapidly?
It depends. When you have an acute pancreatitis, it can be a matter of hours or less than a day. If you have a chronic pancreatitis, is going to be a patient who eats less or less happy. The typical Jack Russell, like the one I had, that you put the food and in 3 seconds it's gone. Maybe it takes 10 minutes. That is a sign that something is not right. So the chronic pancreatitis, the one that takes longer that is because it's mild and it keeps going over time, that gives less symptoms. And normally is eating less happy, slower, or stop eating food but eating home food or treats.
Right.
Also, drinking more. Remember, in Liverpool, we had a case that was a dog that the only symptom was excess drinking. At the end was pancreatitis. So this dog had gastritis, had stomach pain, but was drinking extras to soothe himself. At the end was pancreatitis. We gave pain relief and low-fat diet, and it was cured.
As you're telling me this, I am thinking in my mind that my dog is drinking a lot of water, but I now know that he is suffering from Cushing's. So it's also, I think, very important for pet parents to sort of instinctively try to do a few things, or try to consult their trusted veterinarian as quickly as possible, as opposed to waiting, because these could be so many things, it's just so complex. You cannot really you cannot really pinpoint at the word go, because it could be this
Exactly.
also and it could be that also. It could be sign of anxiousness, or it could be sign of pancreatitis, or it could be Cushing's, or it could be completely something else. So I guess,
Exactly. And when you have a patient, or you have a dog yourself that is drinking too much or urinating too much, there are more than 23 reasons for that to happen. Among them, the psychogenical polydipsia, which means that the dog is anxious for a reason, is just drinking more because there's anxiety, but you have to rule out everything else, because you have, as you said, Cushing's, we have pancreatitis, we have thyroid problems, we have many reasons, some of them life-threatening, some of them not, or that is causing this drinking more. And it is an important thing to do. So if one of the people that are listening to this have a dog that is drinking too much, it would be very helpful to get the first urine of the morning, take it to your vets and ask for a density. When you check the density, if it's very low, you know that your dog is urinating too much and drinking too much and needs to be investigated.
That automatically leads me to my next question. Let's say, and I'm asking you this question because I've seen a neighbor's dog, a very beautiful dog, go through this. Is there a way to preempt a dog from going into a full-blown pancreatic attack, which is extremely painful?
Yeah, not 100%, because we've had patients that they do everything right and still have it. But the best prevention is avoiding fatty foods, because you are making the pancreas work less. When there's a fatty food, the pancreas starts in action. If you have less fat, the pancreas has to work less, so that therefore there will be less inflammation. There are some vets that they recommend to give extra enzymes like Litex. Litex, they are some capsules that they bypass the stomach and they help digesting fat. We actually give this when a dog has a pancreas that is not working. Somebody has to help digesting these fats. So we give these capsules to help. In the same way, if you give these capsules when you have an inflamed pancreas, the pancreas has to work less because part of the work is done. So one potential thing is giving these supplements. So low fat plus less these supplements could be a way of preventing that you have a flare-up in chronic pancreatitis, for example.
And finally, Dr. Carme, we've spoken a lot about everything, and you've shared a lot of information today. But let's say a dog has pancreatitis. What should their care structure look like? Everything from diet to medication to holistic supplements to regular tests. What should the care structure look like for these dogs?
Okay, I think the main thing is to make sure that the diet is appropriate, whether you are feeding commercial diet or you are homemaking it or you are on raw. Anything you do, it would be good to be checked by a vet or a nutritionist better, to make sure that the fat content is low enough. We have to avoid fatty foods like lamb, for example. I would avoid unattended dogs in barbecues, because it's the typical moment where you will have a piece of fat from somewhere, or a piece of cheese from the cheese board, and these things can trigger an episode. Basically, it's about diet, because there's not that many more things that you can control, really. So then feeding structure, when you eat, how, that doesn't matter. It's not like diabetes. This is more like you eat what you eat, just make sure it's low fat. And then in the holistic branch, I'm not a specialist. There's vets that they actually know a lot and they can help a lot with these things. So I'm all for supplements and everything. What I read is that bilberry is high in antioxidants and can act as anti-inflammatory. So if somebody wants to add bilberry as a supplement in pancreatitis, that seems to be like a good idea. But I'm sure people who know about this will give extra help, because yeah, they will know better. But yeah, I know this is safe, and I know that it has no harm to add holistic natural anti-inflammatories or fat reduction, fat binder, something like this. Why not?
Sure. And is there any test that, should be run on a regular basis? By regular, I mean maybe twice a year or once a year.
Yeah, if as a peace of mind, you can run amylase and lipase once a year or twice a year. If it's for something, pancreatitis at least gives you quite clear signs. So when your dog is eating less or vomiting, you can just do it. The CPL that I was telling you, that is more specific. The only problem we have is that in the clinics we have qualitative one. So you do a snap test and you see if it's altered or not. It doesn't tell you a number. If you want a number, that's better. It's more specific, but you have to send it to, in our case, IDEX. We send it to the UK. Then that is better because it tells you how much is going up or down. So if you want to control it, that will be better. It's more expensive. So there are some cases to do that, but I think as a screening, once a year, do amylase lipase. I think it's good. And if you see that it's going on the rise, maybe you have to be a bit more careful.
All right. All right. And finally, one piece of advice or message for our viewers. For our viewers.
Message.
Yeah.
Oh, I don't know. Feel free to ask any questions. I'm happy to answer through our friend. And about pancreatitis, just stay in the low fat side and you will be fine. You will be as fine as you can be.
Thank you so much,
my
Dr.
pleasure.
Carme, for always being, so willing to share information and supporting.